Hi, it's Alex Zubarev for Casey ICU Primary Study Group. Today we will discuss drug elimination. This topic appeared in short answer questions in past sittings and may show up again in the upcoming exams.
Drug elimination is the sum of processes resulting in the elimination of a drug from the body and plasma. The major modes of drug elimination are biotransformation to inactive metabolites, excretion via the kidneys, excretion via other routes, including the bile, feces, lungs, and sweat. Elimination half-life is the time required to remove completely 50% of a given amount of drug from the body. Clearance is the volume of plasma completely cleared from the drug per unit of time. Total body clearance is the sum of renal clearance, hepatic clearance, and clearance by any other routes. The drug elimination rate is the amount of drug eliminated from the body per unit of time. In zero-order kinetic, the drug elimination rate is constant and clearance is variable. In zero-order elimination kinetics, the rate of drug elimination is independent of its plasma concentration. The concentration versus time graph for a drug with zero-order kinetics demonstrates a linear decline. In first-order kinetic, a constant fraction of a drug is eliminated from the body per unit of time. The drug elimination rate is directly proportional to plasma drug concentration, therefore, drug clearance is constant. Plasma concentration versus time curve for a drug with a first-order elimination kinetics demonstrates exponential decline after bolus injection. Let's talk about drug elimination by the kidneys. Renal clearance is the major pathway of drug elimination. Renal elimination is the result of three concurrent processes occurring in the nephron, which include glomerular filtration, active tubular secretion, and tubular reabsorption, active and passive. Small ionized and non-ionized drugs are easily filtered. However, larger molecules, with molecular weight more than 20 kilodaltons, and protein-bound drugs cannot pass glomerular membrane. The glomerular filtrate makes up about 20% of the flow of plasma to the glomeruli. Therefore, about 20% of all ionized low molecular weight and unbound drugs present in the plasma enter the filtrate on each pass. Drug glomerular filtration rate is influenced by its molecule size, molecular charge, protein binding, renal blood flow, the number of functioning glomeruli, which is influenced by age, renal diseases, etc. Tubular secretion. The proximal renal tubule has specific secretory transporters on both the basolateral and apical membranes for some specific compounds. Drugs and their metabolites, especially glucuronic acid and sulfate conjugates, may undergo an active carrier-mediated elimination, primarily by organic and ion transporters, but also by multi-drug resistance-associated proteins. Reabsorption. The glomerular filtrate contains numerous constituents that the body cannot afford to lose. Most of the water is reabsorbed, and there are specific tubular uptake processes for carbohydrates, amino acids, vitamins, electrolytes, etc. A few drugs can also pass from the proximal tubule back into the plasma, as they are substrates for these specific uptake transporters. The urine is concentrated on its passage down the renal tubule. As the tubule-to-plasma concentration gradient increases, only the most polar molecules remain in the urine. Because of extensive reabsorption, lipid-soluble drugs are not eliminated via the urine but are returned to circulation until they are metabolized to water-soluble products, which are then efficiently removed from the body by renal excretion. The pH of urine is usually less than that of plasma. Consequently, pH partitioning between urine with pH 5 to 6 and plasma with pH of 7.4 may increase or decrease the tendency of the compound to be reabsorbed. Elimination of drugs by the kidneys can be estimated by calculating renal clearance. As you remember, renal clearance can be defined as the volume of plasma cleared from the drug by kidneys per unit of time. It can be calculated as urine drug concentration multiplied by urine flow per unit of time and divided by the plasma concentration of the drug. Clearance and the area under the curve of a given dose of the drug are inversely related.
Let's review the questions that appeared in SAQs in the previous exams. Describe the characteristics of a drug that influence its excretion by the kidneys. This question appeared in the first sitting of 2016 exam, and only 29% of the candidates passed it. The college comment on this question was, drug characteristics that might influence the renal excretion processes include charge, size, solubility, and binding to specific structures or protein. Whether the drug is unchanged versus metabolized can influence these factors. This question tests core knowledge of pharmacology principles and should be answered with equations, graphs, or simple clear descriptions of physical and chemical principles. Extended examples and hedged statements about influencing without the direction, magnitude, and necessary conditions for the influence did not score marks.